episodes for this particular series on health in the spotlight have been nothing but educative, intriguing, and enlightening, like I promised earlier. It's our final episode, viewers, and this time around, what I have for you is mind blowing. But before we delve into today's interview, I would like to take a short break and acknowledge our sponsors. So please keep watching, and I'll be right back. Health in the Spotlight is proudly sponsored by Rina's Couture, designing clothing that suit your taste, giving you a chance to be you. H.I.T.S Ultra Sanitary Pad. It's organic, super absorbent, and safe for every lady to use. A very big thank you to Star Bites, the airport branch. Guys, it's a lovely place. Come meet, eat, and drink. Welcome back, viewers. My name is Rina, and I'm always honored to be your host. My interview today is with a kind doctor. She's hardworking, caring, and giving her best. And she got coronavirus from doing what she loves. Her story is quite sentimental, and I'm so glad she decided to share with us today. So without wasting much time, please let me introduce to you our guest, Dr. Akosua Otchere, Otchere Pepra. Welcome to Health in the Spotlight, Dr. Akosua.
Thank you.
Please tell us a little bit about yourself and how it all started.
Okay, my name is Akosua Otchere.
Okay.
I finished medical school in 2019, and like every other medical student, you look forward to starting house job.
Yeah.
Yes, so I started working last year. Yes, and it's been quite interesting.
On a scale of 1 to 10, how interesting is it?
Well, very interesting. But if you ask me how much I love my job, I'll give it a 7 or an 8.
Oh, that's good.
Yeah.
I think I'll recommend you, please. Everyone go to Dr. Akosua. She loves her job, so she'll take very good care of you. So, Dr. Akosua, please, how did it all start? I know you shared a story that you had COVID-19, and please tell our viewers how it all started.
Okay, so we know COVID started somewhere around March. Yes.
In Ghana?
Yes, in Ghana.
Yeah.
Yes, in Ghana. And most of us were trying to put in the measures to avoid getting infected and all that.
Yeah.
So I think 2 weeks prior to me testing positive, I was not feeling too good. Yes.
Okay.
So I tested and treated for malaria. Yeah.
So wait a minute. How are you feeling? Because you could have tested for any other thing, but you went for malaria. So
yes, because at that point in time, I didn't really have the risk factors, because at that point in time we didn't have community spread.
Oh, okay.
Yes, so I didn't have any history of travel or anything like that. So it's just getting tired, body soreness, and everything. Yes, so it's like other symptoms of malaria.
Oh, okay.
Exactly. So
you tested for malaria,
and then just treated myself and went about my work. So I think I was on duty one Sunday, and our duty is usually 24 hours, and it gets into the next day.
Okay.
Yeah, I wasn't feeling very good during that time. So I told my bosses, oh, I think I need some days off to go home, rest, because I don't feel very good. Yes. And
they granted you the...
Yeah, they did. They
Wow.
granted, because I don't skip work. I try my best not to skip work.
Then again, you're hardworking.
Oh no, don't put it that way. Yes. So I was given some days off and I was home. But then I received a call from work that they were doing a random test for COVID. And I was very happy because everybody at work knew, oh, I wanted to test and know my status. I wasn't feeling good, getting tired here and there, headaches. Yeah. You take analgesia, it doesn't get better. And it's only relieved when you sleep. When you wake up, it's back.
Ooh.
Yeah. So I got to work. That was on a Tuesday morning. And went into the office of our nursing officer in charge. And she was like, hello, Akosua, how are you? I was like, oh, mommy, I'm doing very well. How are you too? And she was like, okay. it's rather unfortunate. I couldn't break it to you on
On
phone,
phone.
but then you have come into contact with someone
Oh,
who has started showing symptoms and he has listed you as a close contact.
mercy. No, honestly, how did you react to that?
I just started crying.
Oh, wow.
I broke in her office because
Oh.
at that point in time, we didn't have any recoveries and it was scary because we actually did not understand what it was all about, the mode of spread, and there was no cure, like there's no treatment.
Yeah.
Exactly. So a whole lot of things. So I just broke down in her office. And then
Oh.
I asked if she had called my patients because I was in a room with my patients and her husband to cancel them. Yeah, exactly. So we had to call them in. And she was like, oh, yeah, they are doctor. They are going to look up to you. So if you are breaking down now,
Yeah.
yeah, so I had to put myself together,
Together.
go talk to them and explain things to them.
So I mean, aside the fact that you are likely to you've just been told that you are likely to get COVID-19, you are still the same person who was saying to go to your patients. Aren't you adorable?
oh, there's nothing
So
adorable about it.
how did you learn to like pull yourself together and just gather the courage and not break down in front of your clients?
Okay, so I have a friend.
Yeah.
Yes, I called her and I'm like, oh, so it's not a random test, but I've actually come into contact with
Yeah.
someone. And she was like, oh, don't worry, you'll be fine.
Wow.
So stop crying. I know you're crying right now, but stop crying, you'll be fine. Just put yourself together and then go and take the test. We are all praying for a negative test and
Yeah.
everything will be fine. So
That's a good friend.
yeah, she is.
So you went to your client?
Yeah, I did. I went to her and her husband in the car, and I told her that it's rather unfortunate that we were in a room with someone that had tested positive. And at that point in time, because of the whole stigma and everything,
Yeah.
it wasn't right to disclose who the
Who it
person
was.
was. But we were just 5 people. So
It's very difficult. It's very easy to pick.
easy, exactly.
Yeah.
So yeah, we all had to get tested. And we're going through a lot at that point in time. Yeah, so
Anyway, after the test, you obviously you had to quarantine, or you were still allowed to work before the results came.
No. So I was asked to stay at home. Usually, I think at the beginning of COVID, when you get exposed, that is coming into contact with anyone showing symptoms suggestive of COVID or has tested positive, you have to be in the house for 14 days.
Okay.
Then you get retested. Yes. So I was home. Normally, we give you a symptom chart, and I was given a thermometer by my lovely mom. Yeah, so you chat in your symptoms every day because at the initial stages, some people may not really show any symptoms. Yeah, so I was home.
Oh,
Yeah,
okay.
and I had to go home with my friend too, Phyla, because we do almost everything together. So yes, it was prudent that the both of us go and then stay home.
Phyla, if you're watching this, thank you so much. Thank you for being a good friend. Dr. Akosua, so when you were told that you've come into contact with someone. Now you've gone to do the test. You wait for a while for the results. Did you feel like your symptoms got worse, or did you experience any new symptoms, or how was it like?
Okay, so before my test came back positive, I wasn't really showing any symptoms. It was more of allergies. I have allergies, so my friend actually assumed it was that because I was already sneezing everywhere. If you use any strong perfume or anything, it would irritate me, and I'll start coughing or sneezing or anything. So they all thought, oh, it's just Akosua's allergies, and we all know she has it because when I started work, it took a while for me to adjust to the detergents and everything in the hospital. So they all thought it was normal until it was actually not normal. Yeah, so I didn't really show any symptoms then. Yeah, so I think 4 days after testing positive, that's when I started having some symptoms.
Some of the symptoms.
Yeah, some of them.
You say that even though you treated for malaria, it wasn't malaria.
It wasn't malaria.
Please, if you're home and you're having symptoms of malaria, you may never know. You heard Dr. Akosua, it's probably not malaria. So if you haven't tested, please go and test. Please, can they test in 37?
Oh yes, you can. You
Oh,
can.
okay.
So currently, what we do is that you need an authorization because of the numbers and looking at how the cases have been so far. Yes, we can't just test everybody, the expense and everything. So if you are showing symptoms or you have come into contact with someone, you can just pass by any hospital and then get tested.
Is it for free?
Yes, it's free.
Oh,
It's free.
we like free things. I've tested. It was for free. So me, I went to test. So let's all go and test, okay? I know you had you had your COVID around the March when it was all fresh in Ghana and everybody was like, hey, 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 hey. So tell me, psychologically, how did you cope?
Well, well, it wasn't easy. It was difficult, but thankfully, I had very, very supportive people. My housemates, Fila and Comfort. Yes, they were very, very supportive. So when I received my, it was on the 7th of April actually, and then they called and told me I had tested positive. I couldn't believe it. I was actually losing my mind. I was like, how? Like, how is it possible? Like,
How,
where
how
did
did the person break the news to you?
I... So the person called and went like, is this Dr. So and so? And I'm like, oh yes, that's she. And he went like, when did you start showing symptoms? And I'm like,
Just like
I
that.
took a test, so you should tell me the results because I'm not showing any symptoms. And then he was like, okay, you've tested positive for COVID. I was like, okay, thank you. And he was like, now you have two options. Either we can pick you up to the isolation center or you self-isolate at home.
Two?
Yes.
Which one did you pick?
Oh, self-isolate at home.
Why didn't you choose the isolation center?
Well, I thought I was going to lose my mind. I called my friend and told her that, Fila, I think if I go to the isolation center, I'm not coming back home. Yes. I felt I wasn't going to come back home if I was away. Yeah.
So you wanted to be in a familiar environment.
Yes,
so that you
somewhere I
could
was
heal.
used to. Exactly. So
okay.
I chose the second option. Self-isolate at home.
So how did you cope? How did you really cope with all of these?
Well, I would say, God was helpful. And He gave me people at that point in time to be really there for me. Because I would say COVID is not just about the symptoms or the viral infection, it's more about your mental health. And once depression, everything sets in, your body responds in a way that can actually suppress your immunity as well. So it becomes very difficult for you to heal. Yes. So I remember the very first day, my friends came back from work, my housemates, because the other lady too had to stay in the house because we are all in the same house. Yeah. And the next day she was at my door with a tray with her marks, and she was like, "You, I know you. If I leave you alone, you're not going to get any better. So you have to make sure you eat." So I had all these wonderful people there, but it was difficult. I remember the first 3 days I didn't sleep. And I had to put myself together because I didn't want to scare my parents. My mom would have just come to Accra just to take care of me. She would end up getting infected and all that. So they would equally be worrying. And there wasn't any positive news out there. Yeah. Although there were recoveries, I think the whole world was concentrating on the death more than the recoveries we had. Yeah. So it would have been disheartening. So we didn't tell them. So basically, I had my friends calling, check up on you, encourage you, pray with you, and just make sure you're fine.
Yeah. You really have very good friends.
Oh, I do. I'm blessed with a lot of wonderful people. Yes, I am.
So, are you watching TV?
Well, I lost interest for a lot of things. It was difficult listening to the news, difficult listening to music. Funny enough.
Music?
Yeah. My very first week was a tough one. I just lay in bed, try and sleep. Sleep is not coming. Like, I didn't have interest for anything. Yeah, so once in a while, try and read something not really related to medicine. Yeah.
Was it to take your mind off the psychological?
Yes, to take my mind off everything because I had to block all the noise at that point in time. Because you wake up in the morning, you take your phone, and Medscape is sending you news about COVID-19. Oh, that's not what I want to see at this point in time. Yes, and people are putting on their status, this is that. Yeah, they were all not good energy, so I just had to.
Yeah, I just had to just block everything.
Yeah.
Viewers, I hate to do this right now. I know it's getting more interesting, but I have to take a quick break. I'll be right back with Dr. Akosua to share more of her story. So stay tuned. Health in the Spotlight is proudly sponsored by Rina's Couture, designing clothing that suits your taste, giving you a chance to be you. H.I.T.S Ultra Sanitary Pad. It's organic, super absorbent, and safe for every lady to use. A very big thank you to Star Bites, the airport branch. Guys, it's a lovely place. Come meet, eat, and drink. Welcome back, everyone, and we are continuing our intriguing story with Dr. Akosua. Doc. So, Dr. Akosua, I know you are on medications, and did you take just medications to recover, or you were doing other forms of treatment?
Oh, we had a lot of concoctions to do. You know, social media, there's a lot of things. So one other friend, she was my boss at the department I was
Yeah.
before testing positive for
Okay.
COVID. Yeah. So she sent videos. Oh, this person did this, ginger, garlic, that. Yeah. So basically, I did steam inhalation, and then we used to boil pineapple peels, wash it very well. Pineapple peels, add ginger and lemon, very hot, and then
And then you
drink. Yeah.
drink it.
So yes, I was doing that in addition to all the other medications that were given. Yeah.
Oh, okay. The inhalation, did you put any leaves or herbs or anything?
No, not at
Was
all.
just water that
Yes,
hits?
yes,
Okay,
yeah.
all right, sure. And did you have any side effects with your medications?
No, not at all.
You didn't?
No.
Oh, okay. Because some people were like, it makes you eat too much and all those.
Oh, no.
You didn't face that
Not at all. I was actually at home eating and putting on weight because at a point in time I was okay.
You were okay.
Yes, I was okay. I didn't really have any side effects from the medication. Yeah.
Oh, which means initially you lost your taste, you lost appetite.
Oh yes, I didn't really. Everybody knows I love food, but I wasn't eating that much. I couldn't taste food well, and I think at a point in time I couldn't smell well for like 4 to 5 days. Yeah. And when my sense of smell came back, I cried that day because I was like, God, for so many years, I've never appreciated smelling. Because you can't smell anything. You pick this up, you can't smell it. Yeah.
Made you appreciate the sense of smell, right?
Yes. The things we take for granted.
Yeah, the things we take for granted.
Yeah.
So all throughout this experience, what were some of your terrifying moments?
Okay, so the thought of, am I going to sleep and not wake up? Or am I going to sleep and then start having respiratory distress? Because out there were people that were fine. And then at the end of the day, they started experiencing difficulty in breathing. No symptoms, nothing. Yes. So that was it. But at the end of the day, like I said, I had friends that were encouraging me, praying with me, and all that. So I think that helped and then kept me on track.
Okay. Yeah. So it kept you on a positive.
Yeah, positive side. Yeah.
All right. So Dr. Akosua, how long did it take for you to recover?
Well, I wouldn't really know how long it took for me to recover, but I was home for 6 weeks.
You were home for 6 weeks?
Yeah.
So you're doing medication, you're doing steaming.
Yeah.
You're doing the eating, you're doing the sleeping, no TV.
No going out. Just in the confines of your room. And it's very, very, very depressing because you wake up and then all the people you could go out to, you have to be more concerned about them now. So you're just in your room. You don't leave your room, like you're in your room. If you leave your room and come out, they have to be at a distance. Everybody is in their masks and everything. So it was quite difficult. And I don't know if it's something with the COVID, like you always want people around
you.
Exactly.
Yeah, maybe because you have to isolate and you're used to people.
Yeah.
I think maybe it has to do with COVID-19.
I think so too.
Well, After the recovery, how was it like for you to go back to work? Did you I know did you have to take another test, or what did you exactly do?
Okay, so at that time, you needed two negative tests 24 hours apart to be declared recovered before you go back to work.
Okay,
So they actually came home and took the samples. So it came back negative for the two.
for the two.
Yes.
All right.
Then
Okay.
I went back to work.
You went back to work. How was the reception like at work?
It was I was going to start from a new department, so it wasn't that difficult.
Oh, okay. So you just blended
Yeah, I
in.
blended in. Nobody knew me, and then we're all in our face masks, so nobody sees you, nobody knows you. So it was easy blending in. And I think my colleagues I was working with from the old department were also there, so they made everything easy because we were all very happy to. Oh, it's good to see you, that kind of thing. So yeah,
Yeah.
they made everything easy.
Easy for you to
Hmm.
just fit in.
Yeah,
That's nice.
yeah.
So when you look back at this whole experience, and then sometimes you hear so many things. People say, "Oh, coronavirus is not real. It's real. It's not real." With your experience, what kind of advice would you give to people? What to people who are out there and then they think that it's just a fallacy?
Okay. So COVID-19 is very real. I think initially when it came, everyone thought it was the disease of the rich until we started having community spread because it was those that were leaving the country that were showing the symptoms at that point in time.
Yeah.
But COVID is very real and it hasn't left. We are actually now recording very bad forms of the COVID, that is the COVID pneumonia, in as much as people are asymptomatic. But there are people that have it and do not know and come to the hospital. So please, I beg you, on behalf of my colleagues and I, we have families too.
Yeah.
We have people, some have husbands, some have wives and kids and parents that really
Yeah.
care about them. So for the sake of my colleagues and I, please do the right thing because now people don't wear their masks. They don't do that any longer.
longer.
COVID is there. It hasn't left us, and we all don't know how long it's going to be with us until we find a cure.
Yeah.
So please and please again, protect us.
Thank you so much, Dr. Akosua.
Thank you.
Honestly, you're a survivor. And please continue doing what you love to do.
Yeah.
And viewers, you've heard it all. Please, if you don't want to infect anybody, for the sake of the doctors who will take care of you, the nurses, and for your neighbors and your family and your friends, we need to be on guard and be vigilant. Let's all protect ourselves and stay safe. It's been an amazing time, guys, and I really, really, really want to emphasize on the fact that coronavirus is real. COVID-19 is so, so real. So let's stay safe and protect each other. Thank you and have a lovely day. Bye.